the point of those two presentations was to sort of get us interested in what Yamhill CCO has been up to. And now the rest of our time together is going to be you all talking with each other and with the other folks and with the folks at your table, and then we'll have a little bit of time for group conversation. We're talking about community, and we all have a number of different perspectives we're coming from, but what everybody in this room has in common is you all have encountered the healthcare system, right? And you've had probably some very positive experiences in the healthcare system, and maybe you've had some not so positive experiences in the healthcare system. So that's something we all share. As we think about how do we improve the health of Yamhill County, the folks who live here, we want you to start thinking a little bit about and sharing with someone at your table some of your experiences with the healthcare system. So here's what I'm going to ask you to do, and we're only going to take about 5 minutes, is turn to someone next to you, and you're going to answer 2 questions, and you're each going to share with each other. So the first question is, share a positive experience you've had with the healthcare system. And you can think really broadly about what the healthcare system is, but what's something that you walked away and you said, that was a great experience, and this is why it was a great experience. So first question. Second question, share something that maybe didn't go so well. This happened with this provider or in this setting, and it didn't go so well, and here's why. And so it's just, and you don't get as personal or not as personal as you want. You can say, this happened to a friend, whether it's true or not. But really, it's just an opportunity, right? Because part of this is to help us get to know each other a little bit, but also to get us thinking about health. So take 5 minutes while you're eating and talking, and just share with each other a positive, one person, just turn to somebody, a positive experience you've had and a not so positive experience you've had. We're not going to share this with the rest of the group, so it's just between the two of you, but an opportunity to talk with each other. So go ahead. Okay, I think most folks are ready to move on. I can tell by how quiet, or either that or you all just took a bite of your food. But we are gonna move on to the next piece of the agenda, and this is going to be fun, and it's going to be fast. And what we're doing is we want your input, all of your input, on some priorities and figuring out what should be some of the top priorities of all the things that Yamhill CCO is doing, because Yamhill CCO is doing a lot. And so we have at each table someone who's going to facilitate the conversation and help take notes, and they will identify themselves to you in a moment. But what we're going to do is there's these very colorful sheets on your table, okay? And what we're going to do is we're going to be looking at these, and I'll go over them in a minute, and you're going to take some time and it's going to go fast, but to just think about some of the priorities. What feels most important to you? And I think as I said earlier, we have a variety of folks in the audience, and everybody in this room has an important perspective. And so we want everybody to sort of weigh in and share your thoughts. So here's how this is going to work, and it might feel a little confusing, so just bear with me. So you're going to pair with somebody, the other side, a person you didn't talk to, okay? And you're going to get one of these 4 pieces of paper. On these 4 pieces of paper, there are 4 different topics. One is oral health, otherwise often referred to as dental health. One is member education and chronic conditions. So working with members to get them up to speed on how things are working, and chronic conditions, folks know they're conditions, anything from can be diabetes to mental health issues, but they're things that are persistent, right? So chronic conditions. Another one is behavioral health. Also, when we think about behavioral health, we're generally talking both about mental health services as well as substance abuse disorders. So that's a bucket. And then the 4th bucket is provider education and primary care capacity. And when you look at the topics, so on each of these 4 topics, there's sort of buckets of work and things we can do. So let me give you an example. So under oral health, that's the yellow one, it says increase use and understanding of care that happens outside of a dental clinic. Okay, so that's something, thinking about what could happen outside of a dental clinic to help people improve their oral health. Another one is provide sealants to children to prevent cavities. This is especially important after Halloween. But that's another thing that, what should Yamhill CCO be doing around oral health? And these objectives, these ideas are not just things that came out of thin air. These are part of Yamhill County's Community Health Improvement Plan, otherwise known as the CHIP. And the CHIP was put together by the Community Advisory Council, which is the group of folks, community members, who advise Yamhill CCO. And the Community Health Improvement Plan is based on data, looking at what are the biggest needs in this community. So these ideas of how to improve health in Yamhill County come out of that Community Health Improvement Plan. And what we want you all to do is help us think about the priorities. There's so much work, and we want you to help us prioritize. So let's say you started with this yellow one. You and your partner would read these 1, 2, 3, 4, 5 ideas, and you will try to rank them. I think this is most important. I think providing sealants to kids to prevent cavities is number 1. And I think improving denture accessibility and availability is number 2. So you'll read them with your partner, and then you'll rank them. And then after 2 minutes, I'll ask you to move on, and I have kind of an annoying little bell that I'll ring, right? Silas will ask for more time. I'll say no, but I'll ring the bell, just because we don't have that much time, and then you will pass this to the next group of people, and then you get the green one or a different one, and then it goes to the next. So every 2 minutes, right? You and your partner are going to be talking about a different one. Does that make sense to people? So nod or say no. I'm getting nods, but I'm also getting, but when you see it in practice, and again, you have people at your table who will help you figure it out. So you're going to start with one. In about 2 minutes, the paper moves to the next group, and so on. So if I could have your attention, folks, just to make sure you say no. Yeah, I can't have your attention. If folks could just I have 2 more minutes of instruction, and then you guys can clarify at your table. So at the end of this 8-minute exercise, we'll have all different rankings from the different pairings of people. And then there's one more part of this. So bear with me. There's one more part of this. So then, as a group, you're going to look at and say, wow, under oral health, we all thought that we should increase awareness of preventive dental care as the top priority. That's amazing. All of us thought that. So that's going to be one of our top oral health priorities from this table. So you will, and maybe there's 2, and you'll choose the top 2 in each of these 4, right? And then the last part, and this is your hardest task, the last part is for you as a group to see amongst all of these ideas, what are the top 3 or 4 or 5? It doesn't mean that those other things aren't important. It just means we want some feedback from you all as community members to say, of all the work, here are the things that I've experienced in my community and that I see in my community as needing the most attention. And then we'll have a brief time for you to share your table to say, these were some of the most important priorities we talked about. And these are the most important things we talked about. Or, you know what, we couldn't reach any agreement. And that's helpful information too. Because we all thought these 4 things, we disagreed on some of this stuff. And that's okay too. So we have about 35 minutes to do this exercise. So the first 8 minutes will be the round robin thing, and then the rest of the time will be talking as a group. So does everybody feel clear, pretty clear? All right, I got a thumbs up. So go to it and get ready for the annoying bell in a few minutes. Okay, we're going to come back together. Here's what we're going to do. We have we're going to hear from all of the groups. And here's the way we're going to hear from each table is whoever from your table has been, whoever, if you volunteered or you were volunteered, I'm getting knowing nods from people. You're going to share the top 3. Right, even though you ended up with 8. And here's the important thing about all of this is this has all been recorded, and you are going to make sure Emily gets it. So Emily, make sure Emily gets it. The documents that you have. Say that again. You can leave them on your table. Oh, leave them on your table. We will make sure we get them. But the important thing is that we'll get them, so we can see what your thinking was, and then we'll actually be able to talk to the facilitators at your table to sort of hear a little more. But here's how we're going to share with the full group. So you're going to share the top 3, and then also just share what was sort of interesting. We finished in 2.5 minutes. And a couple of tables finished really fast. I was very worried about the time, but you finished really fast. Or we really struggled with oral health. Or we could not agree on this. Or it was so clear to us that this was the top objective. So we just really have a minute a table. And so we want to hear from each table on this. And then then we'll have about 15 minutes to wrap up. And Laura is just dying to go first. All right, I'm going to stop and I'm going to let Laura go.
Behavioral health, create good crisis response and referral systems to connect people with help. And then we have one more, which is promote regular checkups and screenings. And the interesting thing is that we were all over the place, and we had different lenses. So we had the family dynamic and how do we help families be more successful lens. We had the preventive physical health lens, and we had the once we're in crisis, we need to really be able to take good care of people. And it just made us rank things differently. But all of us said over and over again, that's really hard because all of these seem really important.
Thank you. Who would like to go next? There we go. Everybody all of a sudden looks down.
Go, Christina. Yeah.
So introduce yourself, please.
Is this karaoke? Sing or answer. I'm Christina, and I work at Provoking Hope and Champion Team. Thank you. So on our provider education, our number 1 was encouraging better communication between clinics and patients about their medication and mental health decisions. All right, so then our green one, our member education, we pretty much all agreed offering classes for members on things like understanding their insurance and managing their health, dealing with pain and preventing trauma. Thank you. In our behavioral health, we decided to improve alcohol and drug treatment services. And that one's probably, the number 1 because we all work in the drug and alcohol preventative services. So that's what we came up with. Thank you.
And did you have any observations about your group? Not about them personally.
Oh.
but about sort of the discussion, what was interesting or what was hard or what was...
I noticed on one of them, because these 2 are data people, so I was like, oh, those are the data people's answers. I could tell, because we were out working with so we all had opposite on a couple of them, which I found interesting.
So different perspectives, but still were able to...
Different perspective on what's yeah.
That's great. Thank you, Christina,
Thank you.
so much. Who's next? Look, back there. Introduce yourself.
Hi, I'm Peg Miller, and I'm a pediatrician. And I'll try not to have too much pediatric bias here. It wasn't. We actually had fairly good agreement between the topics. It was trying to figure out amongst to prioritize amongst oral health, member education, those kinds of things that was more difficult. Our top one, and I had to strong arm a few people, but just in looking at trying to sort of how could we impact the most people was providing education to providers about being aware of trauma, culture, and language, and partly because that really impacts physical health, mental health, emotional health, and how we, if we're aware of that trauma, how that care is going to be received, I think, is really variable, and I think that's an important piece. We also talked about the whole thing with classes for members about their insurance and their health conditions. But we decided there were barriers to that too, because oftentimes, because people have a lot more pressing things going on in their life, it's difficult to get them to engage in those classes. So we'd have to offer some sort of incentives or make that kind of part of their requirements for the insurance or something. And then lastly, our third priority was the dental sealants, and ways to perhaps accomplish that is to partner with kids in school.
Thank you so much. I'm right here, so I'm going to go.
I tried to nominate, Diana. I tried. Okay, so our first one was in behavioral health. And hi, I'm Emily. I work at the CCO. And so our first one was placing mental health and addiction specialists in primary clinics and vice versa. And there was a lot of consensus about the mind-body connection and knowing that physical health and mental health are too interrelated to not put them together geographically. And then there was a very long discussion about dental care and really how none of the objectives listed actually talk about increasing access and increasing the number of providers. We can have better referral systems, but you need someone to refer to. And so our little out-of-the-box addition was to bring more dental care and then implement those referral systems. And I guess one theme that I noticed was we talked a lot about referral. That was kind of the top choice in most of them, and so I think our kind of third one would be improving referral systems and education about those.
Great, thank you so much. Are you reporting here?
Hi, I'm Katrina Dowdy, and I'm the AmeriCorps Vista for Yamhill County Public Health. And we had a landslide first place. Every single one of us marked 1, which we thought was really, really interesting because we all come from varied backgrounds, intensely varied, in realms of education, use of healthcare, and everything. And our landslide win was in oral health. It was increase awareness of preventative dental care, especially for pregnant women, people with diabetes, and children. So our next landslide win was only 1 down from that, and that was member education and chronic conditions, the green form. And it was promote regular checkups and screenings, and those really do go hand in hand if we're working on promoting oral health, and we're trying to promote that with our kiddos and our pregnant ladies. Then tying that in with the primary care visits is kind of the next step. So it was nice that they fell in line. Our third was behavioral health, and that was increasing communities' understanding of mental illness to reduce stigma. So we have a lot of great resources regarding mental health and treatment and counseling and options, but there's still a really significant barrier in our community, which is the stigma surrounding mental health. So that was They were all very, very close landslides. It was one little point straying here or there. But we wanted to bring up what was noticed in our group was our next highest was making sure there are bilingual providers and providers in rural areas. But where that really ties in with the CCO, we were noticing, is that you can have an assigned provider who's not necessarily the closest or who's not accepting new patients. And that actually doesn't do you any good when you're trying to find those barriers and find that health care and take care of yourself with preventative medicine. So that's something we thought could be fixed.
Thank you so much. That's great. Okay, who from this table is reporting out?
Hi, my name is Sarah. I'm a Yamhill Community Care Organization member. They all told me that a staff couldn't do it, so somehow I got elected, but I'm seeing a theme here. I got tricked into this. Anyway. Okay. Okay. So I'll start off with the one that we all agreed on. We all ranked as number one was on the provider education and primary care. We all ranked the encourage better communication between clinics and patients about medication, mental health, health decisions, and understanding their health conditions. We all ranked that number one. And then on the oral health, we thought have a good referral process for primary care providers, community health workers, and other clinic teams so that they can direct people to dental health care. And we were all pretty, two of us ranked that as one, and then another one was kind of lower, but as we talked about it, we kind of thought this could also go for other providers, but we just thought, we all want to be proactive about our health, but sometimes it's hard, and if we had a provider that was helping us, or referring us to where we need to be, and like where we need to go, and how we can get that help, we might, people might be proactive of getting the help that they need. And then the last one was kind of interesting because the majority of us ranked it lower on our list, but there was one group that ranked it as their top priority, and it was under the member education and chronic conditions. It was to make sure all materials and communication are understandable, regardless of preferred language, reading ability, hearing, or vision ability, or reading level. And the team that ranked it number one, this is what was interesting, is they said it should be non-negotiable, meaning like, there's just no question about it. It needs to be well understood, and everyone needs to be able to understand it and read it and have education about it. And so as they kind of made that argument, we all kind of came around and agreed that that was really important. So, yeah.
It should be beyond that, but
it's true, but it's on the list, so apparently it's still a problem. So, yeah, that's where we're at. Thank you.
Thank you so much. I'm going to come over to you guys.
Okay. So I am reporting back because I translated, so I didn't just want to hog the microphone today. Okay, so, my name's Christian. I'm a community health worker at the YCCO. And so provider education and primary care. We thought that making sure there's bilingual providers and providers in rural areas, we thought that was really important. And then oral health, increase awareness of preventative dental care, especially for pregnant women, people with diabetes, and children. And also having a good referral process for primary care providers, community health workers, other clinic teams, so they can direct people to dental health care. And then in the member education and chronic conditions, we thought that investing in programs that will reduce obesity in children and adults was really important too. So.
Thank you so much. Who's going over here?
Hi, my name is Lori. I'm a YCCO member, and I also work for one of the providers at Smile Keepers. On all of ours, we all marked number one on every page consistently. So as far as behavioral health, all of us marked number 1 as placing mental health and addiction specialists in primary clinics and primary care providers in mental health and addiction clinics. And on oral health, having a good referral process for primary care providers, community health workers, and other clinic teams so they can direct people to dental health care. We thought that was pretty important. And provider education and primary care capacity, encouraging better communication between clinics and about patients' medication, mental health, health decisions, and understanding their health conditions. And lastly, member education and chronic conditions, we all marked promote regular checkups and screenings as our number 1 priority. And that's it.
So if I understood you right, you said you all marked the same ones as the priority in all of the categories. That's wild. Or they cheated, I don't know. So you guys are next.
I'm Silas Halloner-Steiner, and I'm a board member on the CCO and work here in the local county Health and Human Services. So we had, number 1, increased understanding of mental illness and reduced stigma in the community. Number 2 was mental health and addictions specialists into primary care, vice versa, primary care into behavioral health clinic settings. Number 3 was better communication between clinics. And then up high on the list, we talked a lot about dental care and the need for increased access and preventative care, and in general had some great conversation just about wellness and screenings. And it wasn't consensus. We had a lot of arguments for why we should do checkups and screenings first, but at the end we came to these 3, and it's really fun to hear everybody else's. Lots of similar themes.
That's right. Thank you so much, everybody. So as Silas said, there's a lot of people in a room, right? And there's a lot of consensus. Definitely different opinions, but a lot of conversation. I think people lifted up, the importance of dental health. We heard from a number of you about the importance of integrating behavioral health with physical health. Folks mentioned reducing the stigma of mental health. There was so much. There was a lot of consensus and a lot of richness in the conversation, obviously. And it also sounds like you guys had fun, which is part of it as well. And so, as I said, we will be gathering this information. We'll use this information to sort of complement all the other data and information that the CCO gets as it goes into the community and seeks to improve health. So with that, we just have a few more minutes. And as you all know, it takes, and this is evidence of it right here, it takes a lot of people to make a community healthy. It takes all of you. And I know that Yamhill CCO often acknowledges folks at these fall forums, always acknowledges folks at these fall forums for particular, stepping up or doing something really special. So I'm going to turn it over to Jim, because we all know that all of you make this a great organization. Jim's going to share with us just a few particular call-outs. Here. Okay.
Great, thanks. Another thank you to everybody for coming again. This is such a great and rich experience for all of us to get this level of feedback and to have everybody in the same room breaking bread together is a great experience. There's only one time a year that we get our full board, our community advisory council, our clinical advisory panel, our early learning hub, and this year members together with us so that we can all share in some of the great work that we're doing. What we do annually is a survey to the board and also to each of our committees to acknowledge in a results. There's a few questions that go out, but namely it's just who's the shining star of the year, and this doesn't do any justice, I think, for the countless we have 75 to 80 community members that volunteer on these committees to try to make our members' lives better. So it's a huge shout out to everybody for the commitment that goes into this work. But the awards that we acknowledge this time of year are really for those that really just go above and beyond and put in countless hours and have passion that just oozes to everybody sitting next to them and allows us to keep going. So I'm going to name a few, but before I do, I wanted to, a couple housekeeping things. I wanted to thank the staff for organizing this and putting this together. Second, I want to thank our members who've joined us this evening. It's an incredible honor to share this with you and to also get your feedback. And we welcome your input throughout the year as well, and we can find vehicles for you to communicate with us directly. If you're interested, stop one of us on the way out. We also have our Community Advisory Council that is continually open and recruiting for good voices and people that are passionate about changing the results in our community. So if you're interested in that, talk to one of us as well. And Diana. Pardon? Thank you. So I won't repeat it. I think everybody heard it. And then a big thank you to Diana. Diana does great work with us. She helps us with our strategic planning and all of our meetings, so thank you. So the first recognition that we would like to give is to a countless volunteer and a member of our organization, Rebecca Eichhorn, for serving on our Community Advisory Council. Thank you for all you do. And then we'd also like to thank Dr. Jackie Erickson for her leadership on the CAP. Thank you very much. I'll try to hustle back. So this is a new one for us this year. Is Kyra Donovan with us tonight? No. Okay, so we'll present it to Sui to give to Kyra at the next Early Learning Council meeting. Kyra is a co-chair of our Early Learning Hub committee and is an amazing champion for this work as well as Sui. So thank you, Sui. And last but not least, goes to a member of our board of directors who is also very responsible and accountable for much of this work that started in 2012. Silas? And with that, I think we'd like to invite Lori up. Is Lori still with us? Great. And we're going to go through some. Yay! And were you doing this? Were you doing this back there? Oh, okay.
Oh, dear. Wow. Okay. We heard from Jim number 1 tonight, who talked about building healthier communities together, and he brought us through our history of where we started and where we're headed. And we heard some great information from Jim number 2, who demonstrated how many thousands more people are insured now and the benefit of that, but not the CCO just as a payer, but as really creating healthier communities through addressing the social determinants of health. It was a great presentation. And we were led through great table exercises. That was high energy. That was good stuff. And it was a really great exercise. That we got to some priorities faster than I think I've ever done in any meeting ever. But it was really, really good work. And it's tough because it's all important, right? But the important thing is that we're all doing this together, and we're not going to stop. We're going to keep at it until we have a very healthy community, and that with your help, we're going to get there. We're making great progress. We saw some great initiatives that are in progress that are impacting people in this room. And for that, we're very grateful. We're very grateful to serve you. We look forward to your input on an ongoing way, just as Jim, number 1, expressed. And again, we want to thank you so very much for coming tonight and making it meaningful. Thank you. drive safely, be well.